Yeah, thank you so much for the invitation. I'm really pleased to be here and great honor to have a talk in this professional people. And yeah, I'll talk about GPCR autoantibodies and brain alterations in ME/CFS. And I'd like to show my background because this is the first time I attend this meeting. I'm a neuroimmunologist and a neurologist. And we are seeing the patients with MS or NMO, and I have seen such patients for more than 30 years and doing also research in this beautiful hospital. But 10 years ago, a patient with ME approached me. Oh, there are so many drugs for MS, but no treatment for ME. Why don't you work on this? So I responded to this, and we started to do something for ME. This is my history, my background. So 10 years have already passed. Yeah. Now, yeah, for me, the ME is not very difficult disorders because there is a theory of autoimmune disorder theory already. And there are autoimmunity and virus reactivation. EMS, we know EB virus is involved. And this virus is also the very important subject in MS. We have done much about this virus. So we try to do this work. Yeah, so very difficult disorders can be seen differently at a different angle. So, of course, all the people, experts can see the disorders at single angle or single direction. So I can see the ME from the neuroimmunologist angle. Yeah, I think that's important. And for me, yeah, I am seeing the patients, and the most important feature of the ME is the brain dysfunction and dysautonomia, yeah, which we can evaluate as a neurologist. So brain dysfunction is very clear, although sometimes ignored in practice. So as you can see here, spectral analysis shows the brain circulation changes in most patients, and they complain about brain fog, or difficult to concentrate, poor working memory. This can be clearly categorized as cognitive dysfunction or brain disorders. So neurologists should be able to evaluate this. Okay, but unfortunately, a conventional MRI study usually reveals no abnormal findings in the brain of the patients with ME. So even though neurologists see the patients, the results are negative, okay, no brain disorders. Yeah, but we just like to apply the new method to analyze the MRI data. So I'm a neuroimmunologist, and I need a good collaboration with the neuroradiology department. They know the many new techniques. For example, diffusion tensor imaging, DTI, and related to diffusion kurtosis imaging. Yeah, so I have never heard of that 10 years ago. But they analyze patients' brain samples, brain data, and beautifully reveal that there is abnormal signals in right superior longitudinal fasciculus. Yeah, okay, so you can find the arrowhead shows a lesion. Yeah, so this is absolutely finding. And yeah, this is longitudinal, superior longitudinal fasciculus. It's like a cable bridging the different distant areas of brain, so it's very important. And so neurologists suggest me that cognitive dysfunctions, poor language, poor working memory, may be related to this abnormality. So this is the first published in 2018. Yeah. But this is a work by neuroradiologist. Okay, then we try to show the autoimmune disorders in ME. And we have checked the publications, and Professor Takashi Yamamura produced beautiful data showing that GPCR autoantibodies, including beta-2, beta-1, or M3, M4 autoantibodies, can be detected in ME. So we just like to confirm this in Japanese patients with ME. Okay, and yeah, this is GPCR antibodies. As you know, Dr. Schoenfeld published a beautiful paper. This antibodies can be detected in long COVID and ME/CFS, but we need to confirm. Yeah, on the left side, I showed you the data obtained in Germany by Dr. Scheibenbogen. And on the right side, I showed you the data obtained in Japanese patients with ME. So as you can see here, the same results were obtained, yeah, regarding the beta-2, beta-1, the receptor autoantibodies, and M3 and M4. Yeah, that's reproducible. So it deserves for further investigation. Okay, then we try to combine the brain alterations and autoimmunity. Yeah. Okay. This is another data. Yeah. I'm sorry. Here on the upper panels, you can find the data from ME/CFS patients. And on the lower panels, you can see the long COVID patients. Both are Japanese patients whom we are seeing at our hospitals. So results are quite similar. So there's no reason to emphasize that long COVID and ME/CFS are distinct disorders. So they're very similar. But maybe 30% of the patients have positive for one of the autoantibodies. Not all, of course, but yeah, that's very important. Yeah, okay, then. We like to combine autoantibody data and brain abnormality. So, okay. Now, in this study, 89 patients with ME/CFS data for MRI were reanalyzed for brain network analysis. This is a new method I have never heard, but the radiologist tried to show the brain abnormalities which is related to the higher autoantibodies or, yeah, something. And then they show that anti-beta-1 adrenergic receptor antibodies titers positively correlated with between the centrality in right dorsolateral prefrontal cortex. This is very difficult. But anyway, you can see the figure. Arrows show the area which is abnormal in ME patients who have the high titers of beta-1 adrenergic receptor antibodies. So antibody titers and the brain region correlated. So then this is the reason why I think that this is a neuroimmunological disorders. And yeah, another data shows that anti-beta-2 adrenergic receptor autoantibody titers, in this case, negatively correlated with characteristic pulse lengths in right central gyrus. So, okay, anyway, there are the brain abnormalities linked with anti-GPCR antibodies. Okay, more recently, our colleague introduced a new analysis method, free water collected analysis, something. So not only the conventional DTI indices, they also evaluated the free water collected indices. And again, try to correlate autoantibody titers and brain abnormality. Here, you can find yellow part, right frontal operculum and insula is abnormal as determined by free water signals. And right predominant bilateral frontal operculum and colon radiata, also abnormal, judged by MDT reduction evaluation or something. That's very difficult. But anyway, you can find, again, this abnormality. And the right frontal operculum, abnormal signals were found to be correlated with the disease duration. Yeah, so very beautiful. So there's no doubt about the brain disorders in ME. Yeah, of course, there's limitations of the work. Yeah, this is a cross-sectional study, and we need to analyze longitudinally. And in my guess, some patients recover from ME, so some brain lesions may disappear, I hope, but it is not established yet. And we have just analyzed 4 autoantibodies. Yeah, so there are a lot of anti-GPCR autoantibodies. So if we screen this, then we will be able to see the other brain abnormalities. Okay, then next 4 minutes, I just like to tell you about the B cells and T cells bias in ME. This is not well recognized, I think. But yeah, not only autoantibody type, but B cell repertoire analysis. Yeah, now the next generation sequencing can identify the B cell repertoire. And my colleague, Dr. Sato, beautifully shown that B cell repertoire is significantly biased in ME/CFS patients, published in 3 years ago, 4 years ago. And this is very useful for evaluating the ME. Okay, and then the last point. We recently found that autoreactive T cells have the specific marker as NLP1 or neuropilin-1. This is found in mouse and published in 3 years ago. But this is also useful in human analysis. As you can see here, in the patients with SLE, this T cell population is significantly increased. Okay, then we checked the ME and long COVID compared with the healthy subject regarding the NLP1 positive T cells. So as you can see here, NLP1 positive T helper cells are significantly increased in both ME and long COVID. Significant. Okay, so this reflects the enhanced autoimmunity in ME/CFS. Yeah, about 50% of the patients show the higher frequency of this population. Okay, then we are now thinking about the B cell depletion therapy. Okay, of course B cells can be depleted and autoantibody may partly decrease, but these T cells remain. These autoreactive T cells. What can we do? But now we have the solution. Okay, B cell depletion therapy leads to the reduction of this T cell population. Yeah, this we know based on the MS research. Okay, in MS we use the anti-CD20 antibody and measure this population. And this B cell depletion therapy has many different mechanisms. Sorry for taking many time. But this is my colleague, and this is a hospital located in Tokyo, outskirts of Tokyo. So I hope you will come and visit. Thank you so much. Yeah.
So is there any urgent questions? So if we have the chance to have a neurologist here, can you measure by functional MRI so the brain fog, which is very important for our ME, CFS patients?
Yeah, okay. I have to tell you that this beautiful data based on the analysis of many patients, okay? That's on average, okay? So in individual patients, still we cannot do something. But some patients have the white matter lesion. That's true, yeah.
Thank you very much. Yeah. I think, unfortunately, we have to proceed. So thank you very much again for coming and for this talk and for the discussion.